Okay. Hey, everybody. Welcome to the third installment of our webinar series, Cannabis in Maine, Public Health Policy and Impacts. My name is Matt Wellington. I'm the Associate Director of Maine Public Health Association and your moderator for today's discussion. And today's webinar in the series is about medical versus adult use cannabis programs in Maine. And we're joined by two great speakers to help us walk through what's the difference between the medical program and the adult program. Let me just close my blinds because it's very bright. And so I'll introduce them in just a moment. But before I do, I want to go through some quick housekeeping items. So this project is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services as part of an award to the Public Health Training Centers. The contents of the event here don't necessarily represent the official views of or the endorsement by HRSA, HHS, or the U.S. government. You can get continuing education credits for attending this webinar, and I will share this link in the chat as well. Just choose Cannabis in Maine from the drop-down menu at this link. And then a big thanks to our partners who helped us put together and market these events. So Maine Public Health Association's member section for alcohol, tobacco, and other drugs helped to put this together alongside Maine Medical Association, the Maine chapter of American Academy of Pediatrics, and the New England Public Health Training Center. So thank you to our partners. And everybody is muted on the webinar. You're off video, and we will have Q&A as part of this session. When you submit your question, please use the Q&A function. You won't be able to use the chat or the hand raise function. And then for the last few minutes of the webinar, please stick around and fill out a very short evaluation that we need for HRSA reporting. Super simple. I think it's like 4 questions. And let me quickly introduce our speakers, and then I'll pass it to them. So we're joined by Gabi Pierce, a policy director for the Office of Cannabis Policy at the state of Maine, and Rebecca Boulos from Maine Public Health Association, our executive director. So it's a treat for me to get to moderate a discussion with Becca. So our speakers are going to give some opening remarks about the medical versus adult use programs, and then we'll get into some questions. So with that, Gabi, I'm going to pass it to you. You should be able to share your screen. So I'll stop sharing mine. You can go ahead and share yours.
Fantastic. Thank you, everybody, for joining us today. I am thrilled to be joining MPHA to talk about the programs my office administers. And give me just a moment. Oh, it says host has disabled screen sharing, Matt.
Oh, all right. Give me 1 sec. Let's see.
Okay.
I just fixed it.
Outstanding.
Thank you.
Look at that. Thank you all for your patience. So I am just going to take a few minutes to walk you through some of the high-level differences between Maine's medical and adult use programs. And I want to start off by saying this is not a versus discussion. This is really just 2 separate programs that have grown up on 2 entirely different tracks that, from the office's perspective, serve 2 completely different populations. So starting from that, we have both medical and adult use cannabis in Maine. The medical cannabis program in Maine has been in existence in some form or another since 1999. The infrastructure for the cultivation and distribution of cannabis, medical cannabis, was put in place by a citizens initiative and then tweaked by the legislature from about 2009 to 2011. With the last major overhaul of the medical cannabis program statute in 2018, although there have been some fairly substantial changes in the last couple of years. And as Becca will talk about, there's still some other fairly substantial changes pending. So we will get into that in a bit more detail. But I'm going to be talking about a few big buckets related to the differences between those programs. So first things first, as I've said, the medical and adult use programs are 2 separate programs. In fact, they are supported by 2 completely separate statutes. So the adult use program falls under the Cannabis Legalization Act that was based on the Citizens Initiative from 2016. And was developed by the Marijuana Legalization Implementation Committee from 2016 to about 2018. So that is Title 28B. It's a standalone title. It only deals with adult use cannabis and personal use and cultivation of cannabis for non-medical purposes. And then the Maine Medical Use of Cannabis Act, Title 22, Chapter 558C, is the chapter that is dedicated to the medical cannabis program. So the adult use program, and I'm going to jump back and forth to try and give as much parity and an understanding of the differences between those two programs as possible. So the adult use program legalized the sale, use, and taxation of cannabis for adult use purposes. As I said, we've had medical cannabis in some way, shape, or form in Maine since 1999. Cannabis in Maine was decriminalized in 1976. So it's been around in the zeitgeist and the culture in Maine for quite a while. In 2016, the adult use law was passed by the voters by a fairly narrow margin. I'd say an incredibly narrow margin. And so here we are with that particular law. The focus of our office for both of these programs is regulating the individuals who are engaged in commercial activities of some sort or another. So on the adult use side, we are licensing businesses for cultivation, manufacturing, testing, and sale of adult use cannabis. On the medical side, we are registering dispensaries, caregivers, manufacturing facilities, and inherently hazardous substance extraction facilities for operation within the medical program. But those are two legally distinct principles, licensing and registration. We'll talk a little bit about the features in both programs. So again, looking at the adult use law, it is geared towards getting cannabis to adult use consumers over the 21 years of age or older. It requires mandatory testing of all of the cannabis and cannabis products that are sold to adult consumers. It has a rigorous inventory tracking system that tracks cannabis plants and their products from the point of cultivation through sale to consumers. It requires both state and federal background checks for program participants. So anybody working in the adult use cannabis industry, anybody owning or having a controlling interest in an adult use cannabis business is going to be subject to a state and federal background check. The statute and rules include stringent labeling requirements so that consumers know what they're putting in their bodies, and have several different warnings on those labels depending on the method of consumption. There is a universal symbol requirement in the adult use law. So you may have seen the triangle with the little cannabis leaf in it that says contains THC. That is a required symbol in the adult use program. It has to be on all of the packaging, the retail packaging for adult use cannabis products. And it also has to be imprinted on edible cannabis products so that folks can distinguish a gummy that includes THC from a gummy that does not include THC or other edible cannabis products. And it also includes, with respect to edibles, potency limits for those edible cannabis products. So in the adult use program, a single serving of an edible cannabis product cannot exceed 10 milligrams of total THC per serving and 200 milligrams of THC per package. So you can't package together more than 200 milligrams of edible cannabis products. You can certainly have inhalable or topical products that would exceed those limits, but those that are supposed to be ingested by eating are limited to 200 milligrams per package and 10 milligrams per serving. There is, as of recently, delivery permitted in the adult use program. And we have done several rounds of rulemaking related to that. There were some updates to the law this year that necessitated additional rulemaking. There is also recent allowance for off-premise sales of cannabis and cannabis products at events. They don't have to be cannabis-specific events, but they must be events that are not primarily geared towards individuals under 21. So the off-premise sales law was enacted last year, and then there were a number of changes to that law this year, so that the office had enough information in the law to go forward with rulemaking. So that is what we've been up to on the adult use side. To look at those features on the medical program side, we'll just talk a little bit about that, and I'll show you where those distinctions might exist. So for starters, obviously, the medical program exists to serve patients. So both registered dispensaries and caregivers are authorized to do the activities authorized under the statute for the purpose of serving qualifying patients and assisting qualifying patients. There is no mandatory testing in the medical cannabis program. I say that because I know a lot of folks are surprised when they hear that. We recently issued a report based on some market basket testing that demonstrated that mandatory testing would probably be helpful in the medical cannabis program because of the 120 samples or so that we tested, about 42% of those came back with contaminants that would not be permitted in the adult use program. There is no unified inventory tracking system, statewide inventory tracking system for the medical cannabis program. There are record keeping requirements related to the movement of cannabis through the program, but those are not kept in any sort of centralized inventory tracking system. We are permitted to conduct state background checks in the medical cannabis program, but federal background checks are only authorized in that program for individuals who are administering cannabis on school grounds to pediatric patients. Edible products in the medical cannabis program have to include some sort of signifier on the packaging that says that there is harvested cannabis in there in the package, but it's not as stringent as the universal symbol requirements in the adult use program. There are no potency limits for edible cannabis products or any other cannabis products in the medical program. There is an overall per transaction limit of 2.5 ounces of cannabis per transaction for medical cannabis patients, but there is no limit on the potency of any particular edible cannabis product. And then there is delivery in the medical cannabis program, but it is not particularly regulated at this time. I talked a little bit about the licensing and registration types in the program. I just want to give you a little bit more information about those. So because I think terminology is really important, and we often run into challenges with respect to the terminology when we're looking at municipal regulation. I'm sure you'll hear this at next week's presentation, but there are 4 license types in the adult use program, and they are cultivation facilities, products manufacturing facilities, retail stores, and cannabis testing facilities. On the medical cannabis side, and on the adult use side, each of those licenses is only allowed to do certain authorized activities. So cultivation facilities can cultivate cannabis, but they can't manufacture it into edibles without a separate manufacturing license. They can't sell to consumers for the most part without a separate store license. And I'm happy to answer questions about the limited delivery that was authorized this spring if folks have questions for cultivation and manufacturing facilities, but I don't want to muddy the waters right now on that. On the medical cannabis side, the registration types, caregivers and dispensaries are what's called vertically integrated. So they are able to do pretty much all the authorized activities in the medical cannabis program with respect to cultivation, manufacturing, and sales. With the exception of that inherently hazardous extraction that I was talking about, inherently hazardous substance extraction. They need a separate registration certificate to do that. We don't currently have any registered manufacturing facilities or registered cannabis testing facilities in Maine. The licensed cannabis testing facilities that test adult use cannabis are also authorized to test medical cannabis. Then the last thing I just want to touch upon is the role of municipalities with respect to both of these programs, because I think, again, this is one of those things that comes up more often than you would think. And municipalities have been a part of this discussion since day one with respect to the adult use program, and have been coming into the discussion on the medical side more and more over the last few years. So the adult use program requires that a town or a municipality has to affirmatively opt in to allow a particular kind of cannabis establishment within their borders. And they can do regulations related to how many, where they can be zoned, that sort of thing. And that is a blank slate. So every single applicant who wants to get a adult use license has to get local authorization from a town that has opted in before they can get their license. On the medical cannabis side, towns now, as of December 13th, 2018, must affirmatively opt in for any type of establishment except registered caregivers in order for that establishment type to operate in the town. So they have to opt in for registered caregiver retail stores, dispensaries, manufacturing facilities, and testing facilities. However, those caregivers that were in operation before December 13th, 2018, and who were operating a cannabis store in a particular municipality with local approval did not need to show proof of the opt-in or the local authorization. That is particularly tricky, I think, for towns because of the really robust confidentiality provisions in the medical program. We can't provide a list to towns about the caregivers who are operating in their town. We can only confirm whether or not somebody is actively registered with the office. So we can't provide that information to towns. So towns have to kind of find out through their own processes who is operating as a caregiver and who's operating a caregiver retail store in their town. So I think I've given you enough background so that Becca can kind of talk about the legislative environment, what's happened recently, and what we're looking at for the upcoming session. But I am happy to answer questions once she has completed that. So thank you.
Thanks, Gabi. That was great. I have many questions for you, but I'll hold on to them. Pass it over to Becca.
You can see this now?
Yep.
Okay, cool. Thank you. Good afternoon, everyone. Like Matt said, my name is Rebecca Boulos, and I'm Executive Director at Maine Public Health Association. I'm going to try to dovetail a bit with Gabi's presentation and provide a little bit more information about what's currently going on in the Maine legislature and ways that people can get involved. And then, like she said, at the end, we're happy to answer questions about our respective presentations. So here's a general outline of what I'm going to be talking with you about. The first is to just give a bit of information about the legislative committee with jurisdiction over cannabis, both the medical and adult use programs, discuss a few recent pieces of legislation, and if you signed up for this series or for this webinar, you signed up for the full series, which means that next week you should have a link to join us next Wednesday at noon to hear about some of the work going on at the municipal level. And so some of these bills that I'm going to be talking about will, I imagine, be discussed as well next week. I'll be sharing with you a bit about some of the carryover bills, which will be taken up next January, or at least next spring. And then lastly, ways for you to get involved in advocacy, in education, but really just involved in this issue. So the first thing I want to talk about is the assigned committee. I thought it would be helpful to understand a bit about which committee has jurisdiction over cannabis policy. And in Maine, it's the Veterans and Legal Affairs Committee. There's a lot of text on the slide, but really I just wanted to give you a sense of the other issues that are in front of this committee. And then at the bottom, there's a link to the committee's webpage. And I've provided that so you can see their meeting schedule, get added to their mailing list, which means you'll get an alert when a public hearing or a work session has been scheduled, or if there's been new language for a bill. You can also, on that website, see which legislators sit on this committee, and you can read testimony that's been submitted to the committee on cannabis and any other bill that has been put in front of them. Just a quick note to say that you will see that alcohol policy is also under this committee's jurisdiction, but what you don't see is tobacco. And a bit of interesting history there. A couple of decades ago, the tobacco policy issues used to be in front of this committee, and now they're under the purview of the Health and Human Services Committee. And I raise that just as a point to note that it is possible for the committee of jurisdiction to change. We just have to advocate for that. So there are differences between substances, whether it's cannabis or alcohol or tobacco, in which committee has jurisdiction over those issues. So just a few points about recent legislation, and this kind of extends a bit of what Gabi was talking about. There were changes recently to the delivery provisions, and the major one is that even if a municipality has not opted in to cannabis sales, delivery is allowed within those municipalities. And I do want to just point out that, as an aside, by increasing delivery options in the state, we are increasing pollution from transportation, even as we recognize that in Maine, the transportation sector is responsible for just under 50% of our greenhouse gas emissions. So trying to increase access in one area is now leading to worsen air quality in the other area. The second piece of legislation around potency is that the legislature recently approved doubling the allowable THC potency in adult use products from 100 milligrams to 200 milligrams. So when Gabi was comparing the programs, you saw that there were limits, and she did note that it has that now it's 200. But I want to just extend that to say that it was doubled, allowing that increased potency. But there weren't changes to the confidence intervals allowable for testing to kind of tighten that accuracy. And then the last, again, extending what she mentioned around off-premise sales, municipal approval is still required for sales to be at fairs and festivals, at least for now, and hopefully going forward. For carryover bills, which again, these are bills that will be taken up by the Veterans and Legal Affairs Committee starting next session, and these have to be reported out by January 30th, so it's a very tight timeline. The first is around product labeling, and then the second is around on-site consumption, and there are both bills for medical and adult use considerations. We have concerns about that in particular, just wanting to make sure that given these considerations around public safety and overconsumption accidentally and training, there's just a lot of things that go into on-site consumption. So those are, again, two of the bills that will be picked up, at least for now, by the committee next session. So how can you get involved, and what do we need to advance public health oriented policy in the cannabis field? And what we need is your help. When I've talked with committee members about what they need to see, who they need to hear from, and certainly who they need to hear from in the health space, they want to hear from more people. They want to hear not just from lobbyists or government relations staff, from OCP, although they do want to hear from us, Gabi, but they also want to hear from parents and teachers and community members, from youth, from patients and adult use cannabis participants, medical providers, law enforcement. They want to hear from other people in the community. So I would just ask you to please consider, if you are in Maine, scheduling a meeting with your legislator. This does not need to be a lobbying meeting. You don't need to talk about a specific bill, but in Maine, we have our legislators are very accessible. You can usually see them in the grocery store, the post office. It's usually very easy to schedule time to have coffee or a Zoom chat and just talking about any issues that are on your mind. It could be cannabis, it could be another public health topic, but really just making sure that your legislator knows that health issues are important to you. And then that way, if a bill does come in front of them, they think, oh yeah, I talked with this constituent, they had, raised this issue with me. And so they've already had that initial conversation. If you don't know who your elected officials are, or you want to find their contact information, Maine has this really awesome, I think, program called Maine Voter Information Lookup. And if you just go to that website and enter in your address, that will provide you with information about both your municipal officials, but also your state and then your congressional representatives as well. So I encourage folks, if they haven't already, to please check out that service. And again, with this meeting, it really can also just be to introduce yourself and tell them about what you do in the health field or non-health field, and to educate them about the work that you do. It's also helpful to share stories. I think that we can sometimes forget that stories are also data, and they're also helpful for legislators to hear about people's experiences. So it really can make an impression and impact legislators' thinking when they can attach a story to a particular issue. So I encourage you, if you're comfortable, to share any stories that you have. If you're in Maine, would love if more people wanted to come to the State House, even just to put a face to a name in meeting your legislators, to come and listen to a public hearing or a work session. If you wanted to provide testimony, that would be great, but it also can just be helpful to see how it works and what goes on at the State House and what's it like to participate in a hearing. You can still participate virtually, so that is still an option. You can hear and see what's going on there. But it also, was great to be able to take time to travel to Augusta and see what's going on at the State House. And then another way to get involved is at the municipal level. So as I said earlier, there are some preemption bills, and that means that state policy trumps local policy. So even if local policy, for example, was not to opt into cannabis sales, state policy overrode that by allowing delivery. So there's still access within the municipality. But in other instances, like off-premise sales at fairs and festivals, that does still require municipal approval. So local action does matter. And I would say that that's true for education campaigns, making sure that retailers know the rules, that about policy, about the impact on youth use, which was part of our webinar a little while ago. So just general education campaigns, that's great at the local level, and another way that folks can get involved. And I also think it's important, the same way I said to talk with your state legislators, it's also important to talk with your local elected officials on your town council or select board. Again, it's important for them to hear from people about issues that are important to them, whether it's cannabis policy or something else. And I think the same can be true for meeting with school officials and others in the community, to hear what's going on and to share either yourself as a resource or your work. And then the last way to get involved is by writing an opinion letter, either to your local circular or to a statewide paper like the Portland Press Herald or the Bangor Daily News. Opinion letters do matter. Legislators read them, and it can help influence media coverage, and it also can help influence legislators' opinions as well as others in your community and across the state. So with that, I just want to reiterate that we certainly are going to have a conversation now, but this is my email, and I'm happy to talk more about this or other public health topics you're interested in, but also to help navigate the state policy process, help coordinate a meeting with your legislator, again, if you're in Maine, or to other ways to get involved. I will just also say that Maine Public Health Association does convene, as Matt said, an alcohol, tobacco, and other drugs group, which is who helped organize this series. And I would love if people wanted to get involved with that, either on the advocacy side or on the education side. So just a little plug to consider joining the association and at least joining that member section. And again, just want to echo appreciation to you all for taking the time to join today and to hear about this topic. And I'm looking forward to the conversation. So thank you so much.
Thanks, Becca. So a reminder for folks, if you have a question, please use the Q&A function. We won't take people off mute. And so I don't use the hand raise, don't use the chat, use the Q&A, and I will do my best to relay those to our speakers here. So I'll kick us off with a question. Gabi, when you were going over the differences between adult and medical, you said sometimes people are surprised when they hear that there's no mandatory testing in medical use. I was certainly surprised. So can you share why that is? Is it as simple as the laws and statutes have just been around for much longer, so we'd have to backtrack to do that? Why is there testing in adult use but not in the medical use program?
Yeah, I think you actually hit the nail on the head, Matt. These, as I've tried to make super clear, these are two separate programs supported by two separate statutes that came up at two separate times and in two separate political environments, quite frankly. So at the time that medical cannabis started in Maine, or at least the program started in Maine, testing was not the standard across cannabis industries, and indeed there were not formalized markets in most states when Maine allowed for medical cannabis initially. And excuse me. And since that time, there has not been a lot of appetite for that. I will also say that the program, the medical cannabis program itself, has evolved pretty substantially since its first conception. So initially, there were only 8 dispensaries located in the 8 public health districts across the state, and caregivers were also authorized, but they were only allowed to assist up to 5 patients at a time, and the patient had to designate that caregiver as their caregiver, or they'd have to designate a dispensary as their dispensary. And so there was a lot more kind of face-to-face interaction, a much closer relationship initially. Given the changes that have happened to the program since 2018, the program is really commercialized. There are a lot more arm's length transactions. There's a lot less interaction with your farmer, with your cannabis farmer. And so we do have serious concerns that with all the wholesaling that's happening, with the fact that there are 106,000 patients across the state, and over 1,000 caregivers across the state, that there are a lot more arm's length transactions happening than there were before the patient designation requirement went out the window in 2018. And so there's definitely a need for testing, and thank you for sharing that report. But it just has not been a priority. And there's also concerns, and we've addressed these in the report, but there are concerns that we want medical cannabis to be affordable for the patients who are accessing it. And the cost of testing cannabis, it does cost money. And so there are concerns that that cost would be passed on to patients. We have not seen testing impact the cost to consumers on the adult use program. In fact, we've seen a natural market cost decline since the program launched in 2020. And so we are skeptical that introducing testing into the medical program would have a really substantial impact on the cost to patients. But that is certainly something that has come up as a concern for folks when we've had these discussions at the legislature and with stakeholders in the past.
So your report found 42% of the samples you tested were contaminated with at least one contaminant. What is the level of contamination like for the adult use program? I haven't looked at I don't know if those results are available. I haven't looked at them. What is it usually like?
That is a good question, and I wish I had that data at my fingertips. What I can tell you is the testing program in the adult use program is set up so that anything that is that exceeds a contamination threshold is not going to make it to store shelves for sale to consumers. So the testing program serves as a roadblock to contaminated product getting to market in the adult use program. So I can't give you those figures. We have them in the hopper and we'll have them for the legislative session, but I don't have those at my fingertips. So, but it is much lower than 42%. And there are processes for remediating some of those contaminants that are used in the adult use program. But like I said, contaminated products that exceed the thresholds that are set out in our testing rules do not make it to market, or are not supposed to be making it to market. So,
Right. So let me ask an audience question right now from the Q&A. So this person says they've been in prevention for a while, didn't realize the lack of regulation and testing medical cannabis, which is it's most concerning given several teenagers they know who have been granted medical cards for anxiety. And their question is, are there any folks working specifically on this access piece of teens and cannabis? And are there any clear stipulations on what is considered appropriate medical use? And I can pass that to Becca.
Yeah, that's a really good question. So last session, there was a bill submitted by Representative Walter Reisman. It was LD 94. And this bill was specific to medical cannabis and minors. And right now in Maine, the criteria for obtaining a medical cannabis card are very broad. And actually, I would say that dispensaries market it that way. I'm not going to speak for all dispensaries, but there are dispensaries that market it that way. If you go to some websites and look up eligibility, one in particular, I remember there was a section that said who is eligible like for a medical card, and then underneath it said everyone. And I mean that kind of reflects the criteria. They are very, very broad. And providers are not required to be in Maine. They're not required to disclose if they receive funding from the cannabis industry. So there are some conflicts of interest there, I think. And there isn't, there's not a requirement for a face-to-face or even telehealth meeting to get a prescription. It's just, my opinion is that it's very easy to get a medical card for minors. I don't know, Gabi, if you disagree with me on that, but that's my opinion.
I don't disagree, and I will say that we talk a lot about individuals between over the age of 21 in the adult use program. In the medical program, kids are kids or pediatric patients are pediatric patients until they're 18. So there are individuals between the ages of 18 and 20 in Maine that cannot access the adult use market, but can access the medical cannabis market. So I'm not going to editorialize too much, but I would just say there are not a lot of statutory barriers to obtaining a card.
So this is a question, my own question, because I'm new to this. What does it mean to be a caregiver in the medical program? What does that mean? What are the qualifications? What does someone have to do to qualify as a caregiver?
Yeah, I'd be happy to take that one. So in Maine, an individual who's over the age of 21 and who can pass a state background check that demonstrates that they don't have any disqualifying drug offenses, which is a term that's defined in the statute, can apply for and obtain a caregiver registry identification card. There are fees associated with that application and the renewal thereof. But to be a caregiver means that you are able to cultivate, manufacture, and sell medical cannabis to qualifying patients and to other caregivers and to dispensaries. And in Maine, we use the term dispensary in the law differently than a lot of other states do. So dispensary is a defined registration type. There are limits on how much cannabis a caregiver can cultivate. So they can cultivate up to 30 plants or 500 square feet of mature plant canopy. Dispensaries are not limited in how much cannabis they can cultivate. Beyond that, there really aren't a whole lot of substantive differences between the activities that are authorized for those two registration types. But historically, caregivers have been those smaller community-based individuals who were only serving a handful of patients, whereas dispensaries were the more commercialized operations that were serving patients in those 8 public health districts. That has really changed dramatically since the changes to the law in 2018 and before that. So caregivers and dispensary stores look very similar, and folks will often confuse the two. So, but those are the distinctions in the law, at least I can say.
Yeah, and you referenced some confidentiality protections for caregivers. So just to clarify for me, so in a town, the list of caregivers who might be growing and manufacturing medical cannabis is not available to town officials and regular, like I can't, as a citizen of a town, go to my town's website and search where are these caregivers located. Right. Okay, and then there's a question from the Q&A here. Do we have a patient registry or just a caregiver registry?
It's a great question, and it's one that I have been answering repeatedly over the last year. So I want to be super clear. There is no list of patients that is maintained by the state of Maine. The state of Maine does not have a patient registry. Patient can demonstrate that they are a certified patient, qualifying patient, by producing their patient certification card, which comes from their doctor. It's printed on tamper-evident paper or tamper-resistant, tamper-evident paper. And an image, a digital image of that card can also be used to obtain medical cannabis. So that's what the patient credential looks like. It's given to them by their certifying provider, and the state does not maintain a list of those folks who have obtained patient cards. We keep track of how many cards have been printed, and so that's where we come up with our patient number. To just touch upon the confidentiality provisions a little bit more, the confidentiality provisions in the medical cannabis statute prohibit us from disclosing information related to patients or caregivers. We can confirm that somebody has a valid caregiver registration or registration card if we're asked by a municipal official, but we can't say, you know, Gabi and Becca are the caregivers that are operating in your town. Here's where their grow is. Here's where their store is. And so we do have concerns about that because it makes it hard for towns to understand the scope of what they need to regulate without knowing who is operating within their town. And those confidentiality provisions predate the commercialization of the medical cannabis program. So again, I think some of that is really a holdover from the more individualized, when folks were operating out of their homes and didn't necessarily want folks to know where a cannabis grow was or where their product was.
Right. So I wanted to go back to testing for a moment. So I'm curious, Gabi, if you have been approached by medical dispensaries or caregivers or folks who actually want to see more testing because they think it's key to having, you know, a quality product for their patients. Have you had those? Have people approached you with that? Because it's something we're thinking about. Like that's got to be part of the business strategy here. You want to sell a quality product, and testing is part of that.
Yeah, we certainly know, and we noted this in our report, we do know that some folks are testing in the medical program voluntarily. Like I said at the top, the testing facilities that are testing are conducting mandatory analyses for adult use cannabis are also authorized to test for medical program participants, patients, the general public. They can test cannabis for anybody who wants to bring their cannabis in and have it tested. We certainly have folks who are doing some testing. We have some who are doing all of the contaminant testing that we require on the adult use side, but it's not mandatory. And kind of the age of those tests and those test results and how frequently those tests are conducted is really like playing whack-a-mole. It's up to the individual producer, or if somebody's purchasing wholesale cannabis from somebody, they might ask for a certificate of analysis. around the time our report came out, we also provided some resources for patients about how to talk about test results with their providers, their caregivers, or their dispensaries, what to ask for, what they're looking at when they get a certificate of analysis, because I've been doing this for 5 years and I'm still like discovering little nuggets in these certificates of analysis. So we tried to provide resources for patients to be patient advocates for themselves, because that's my background. Before I came to cannabis, I did patient advocacy. So yeah, so it's very important to us that patients and consumers have the tools they need to make decisions for themselves, whether that's test results, whether that's label information, whether that's knowing that something contains, 10 milligrams of cannabis and 5 milligrams of THC and CBD. All of those things, we just want to empower folks to be able to understand what they're putting in their body. And I just, if you'll indulge me for a second, there was a question about engagement with in the Q&A, and so I just want to touch upon that a little bit more. Our office is engaged with a number of different public health groups, and we sit on a number of committees. But we are actually going to be doing some outreach through our office to our public health partners on a regional basis starting in January. So keep an eye on your inboxes. We are reaching out to folks and setting up those meetings. We want to come to you and hear about your concerns, and also just kind of develop a more robust relationship. So we certainly, we see a lot of Becca in the legislature, but we would love to see more of you. And we hear from parents and school officials and doctors all the time about their kind of one-off concerns related to these issues. And so we certainly think those voices are important for the legislative process, and also when we're doing rulemaking. So.
Yeah, thank you, Gabi. You can always have more of Becca in the legislature, though.
Yeah, just a little bit, just a couple of other things, and it's sort of answering that question as well as another one. I do think that there could be opportunities. Well, one, I did upload a handout that Gabi was talking about in terms of what people who participate in the medical program, types of questions they can ask for, and just explaining like what's in those reports to help them, facilitate that conversation, but also understanding. So there is that. I also think that parents and youth can have a conversation with their healthcare provider about cannabis and health, and if it is something that they should consider for a course of action or not, and have that conversation. Right now, it's not required for someone who gives a prescription to participate in training. AdCare Maine does provide trainings on cannabis for providers, and I will find that. I'll try to find it right now, and if not, we'll send it out in the follow-up materials. But that way, there can be some information for providers, whether they want to prepare for that conversation with patients or just for their own knowledge. But to have that, I think that would be, really, really helpful for advancing knowledge in this area. I think those are kind of the couple of things. And then Gabi wants to add to what I just said, but I did just want to flag that is a resource that's available for people.
Absolutely. And thank you, Becca, for pulling those links so fast. You're doing a great job at that. I appreciate it. The other thing I wanted to say is our office has had a couple of public health education campaigns targeted youth and young adults over the last couple of years. I believe our next public education campaign with the same vendor is actually going to focus on adults who interact with teenagers and how to have those conversations. As the parent of a 14-year-old, it's certainly something I'm thinking about. We have 14-year-old, a 10-year-old, a 7-year-old, and a 6-year-old. So having age-appropriate conversations about cannabis and other substances is something that is super important. And we know that folks need skills and resources to have those discussions, because they can be uncomfortable and sometimes they can feel hypocritical depending on the parent. So we certainly understand that there is a need for more of that. And really we'll look to you all in our discussions in January for what future efforts should look like.
Thank you, Gabi and Becca. So I'll ask another question from the Q&A, and then before I do that, I'll ask the person who asked, how does the enforcement process work? Can you just clarify that a little bit before I ask the speakers, because I'm not sure what that's referring to. So please clarify that in the Q&A. But while you're doing that, I'll ask another question here. So someone said they visited many retailers as part of their position, and have seen several children hanging out with their parents who are managers in these retail stores. Is there any law on the age requirements or training requirements of either medical or non-medical, adult use establishments and having minors in there? So, Becca, do you want to start? And then Gabby can weigh in.
Can you let Gabby answer first, actually?
Yeah, so on the adult use side, there are age gates right at the door. So individuals under 21 years of age are not allowed in adult use cannabis establishments, whether it's a store, whether it's a manufacturing facility, a grow. Those age gates do not exist in the medical program. And so we certainly have recommended training around checking photo IDs for those individuals who are verifying that somebody is over 21 years of age. But we have certainly heard that there are kiddos in some of these medical cannabis retail facilities and certainly share those concerns.
Yeah, sorry, Matt, I was pulling up the links. That's why I asked Gabby to answer. I mean, the other aspect of that is not necessarily just in the store, but also what happens outside of the store. On a webinar, a cannabis webinar I was part of a couple weeks ago, maybe even a couple months ago now, there was a question about whether retailers can be offering trunk or treats. So intentionally drawing kids to the business, and it's in the parking lot, but like what kind of message does that send? And some, some questions related to that. So I think it's both the access piece in the store, like Gabby was talking about, but it's also what goes on adjacent in the parking lot. And the marketing, I mean, the marketing of some of these products is quite extraordinary with, cartoon characters and flavors similar to what we see in tobacco. So I think that there are some other elements of this that can make it more attractive to youth. And that's something else that we are paying attention to, and I think need to continue to do that.
Yeah, thanks, Becca. I drive by a cannabis establishment on the way to drop my daughter off at daycare, and I'm always so intrigued by the signs and the marketing. Anyway,
one?
What's that?
Just one cannabis establishment?
One in particular.
There's one at the end of my street and another one down the road. That's why I asked.
Yeah. So can you walk through, Gabby, the enforcement in the sense of policy violations, unauthorized products, compliance checks? Can you give kind of a broad overview of the enforcement process there?
Okay. 30,000-foot view. We have an entire compliance team. So we have a licensing team that works with program participants during the licensing and renewal process. And then we have a compliance team who does pre-license inspections at our adult use facilities. We're doing more pre-renewal inspections on the medical side now. Our compliance team has grown from 2 contracted Maine Sheriff's Association folks when the office was first founded to a team of, I think, 14 or 16 field investigators and some supervisors. And they are geographically dispersed across the state, and they are doing scheduled compliance checks. They are doing, like I said, pre-lecture inspections. They're investigating complaints. We do have a complaint form on our website. If folks have concerns about anything that's happening out in the community, feel free to drop us a line through that. It can remain anonymous. But we do have a fairly robust compliance team. We certainly could use more because there are so many caregivers spread so far across the state. It is hard for us to get in to check those on a regular basis, on an annual basis. We're getting better there, but we generally provide technical assistance when we find minor violations or violations that can be attributed to folks just really not understanding what the heck the regulations say. And so, excuse me, we do have a compliance team that is all administrative, do not do any law enforcement in our office. And so a lot of the stuff that's been in the news lately are illegal cannabis activities that fall beyond our regulatory purview. So.
Thanks, Gabi. So in the last 5 minutes, I just launched the evaluation that folks can fill out as we wrap up here. It's super simple, so please do that. We have another question here that someone was told that at a medical cannabis store in Augusta, they got around selling more than the limit by having the person go through the line multiple times with different transactions. Does OCP have this practice on their radar? And if so, any ideas on how they plan to tackle that challenge?
Is on our radar, and as I mentioned, the limit in statute is a per transaction limit, except for visiting qualifying patients from other states. Theirs is a limit for every 15 days. I honestly, off the top of my head, I can't recall if there's been a bill to address this in the last couple of years. It's certainly something that's been on our radar, and you know, changing that to a per day limit might be it would be an option to address that particular concern. I don't know how enforceable that would be in the absence of inventory tracking and some of those other controls that would allow us to know if somebody's gone through multiple times in a day.
So let me ask the final question, and we'll wrap up in a couple minutes here. So what do you think should be the next steps, in terms of policy, regulation, legislation? What do you want to see happen moving forward for either the adult use program or medical use program in Maine? And I can ask Becca to start, and then Gabi, you can go after that.
I mean, my impression, and Gabi might disagree with me about this, but my impression is either it's very bifurcated in the legislature or in the state house. I'm going to say in legislature, in the state house. There seems to be this vibe that you're either for just open market, open access, everybody can have what they want when they want it, or you're like reefer madness. I think someone put that in a comment. You're just like, you want nothing. And I would love if there was a way we could come somewhere in the middle a little bit more, and be able to have a conversation about public safety and about some of these parameters. I mean, like provider training, if they're going to be putting out prescriptions for cannabis and understanding some of the counter indications, like what happens, just, general knowledge. It is really hard to have that sometimes. And I love that OCP prepared that handout for patients in the medical program, to have some self-advocacy and agency and learning about testing and being, kind of given that information about how to ask the question just to make sure that the product that they're consuming is safe, and just how do you have that? I think we can continue to as the public health community, as the state, can continue to do a better job communicating to the public, whether they're patients in the medical program or users in the adult use program, on the differences between these, and on opportunities for either individual agency or just general education. So that's my perspective. I don't know where you're at on that, Gabi, but that's kind of how I'm feeling right now.
I probably won't comment to my perception of what's happening under the dome. But what I will say is I think it's really important for everybody who is making decisions, policy decisions about this, whether they be legislators, whether they be us in the executive branch, have an understanding through the stories you all have and you're collecting about the impact of cannabis on your communities, both on an individual level and if there are kind of more systemic challenges or opportunities. I would say understanding what it looks like to have cannabis establishments and cannabis economies happening in your town is really, really important, because then we can identify challenges and bring forth solutions that actually address those. Because a lot of this has happened, you know, in a theoretical vacuum. At least cannabis policy over the last decade or so happened in think tanks for quite a while, and then we're in the real world, and there's a whole lot of practical implications that weren't necessarily accounted for. And now kind of making the case for why those are important. There are important interventions that need to be taken. Can't happen without data and stories that support those interventions. So that would be my call to everybody to be engaged, remain engaged. I want to make sure that my contact information is distributed after this. I am the policy director for the office. I am happy to connect any of you with my colleagues in the office. We have a great team. And so happy to point you in the right direction if there's anything you have questions about or any concerns you want to pass along. Happy to hear those as well. And like I said, we do have that complaint form on our website. So if folks do have concerns about things that are happening in the communities, please feel free to drop us a line.
Thank you, Gabby and Becca. That wraps us up for today, and tune in for our final webinar in our series next Wednesday at noon about state policy and municipal policy. So thank you to you both. Have a good rest of the day, everybody. Bye.
Thank you.